I'm Gisele Bousquet, and this is Healey. We're here from the Brigham and Women's Cardiac Rehab Program out in Foxborough, and we're here to talk to you about exercise and help you get moving a little bit. So to start, I'd like you to join my little friend here and stand up. Everybody stand up. Take some nice big deep breaths in. Reach up to the sky. Oh, maybe just stretch over a little bit. Reach out. Nice good stretch. Doesn't that feel good? And then stretch out to the other side. Nice big deep breath. That's great. Now you can march in place a little bit. If you feel like really dancing with the guy, you can go to town. It's okay. And the other thing that's helpful to do during the day too is just do a little squatting. Stand up, and then squat down, hold it for a little bit, stand back up again. Great, you can sit down. So these are things that you can do during the week at your desk. You can stand up, stretch, march in place a little bit. As you probably know, a lot of employers now are even having workstations that people stand up and walk on treadmills, so nobody's going to think it's crazy anymore if you stand up and do a little exercise. We really don't want you sitting for too long during the day. So we're going to talk to you today about how exercise can help you reduce the risk of heart disease, give you some examples of exercises you can do at home, and talk to you about tips to help work exercise into your day. Hippocrates once wrote that walking is man's best medicine, and we now have many years to prove that he was right. It is one of the best treatments to prevent heart disease, as well as decrease the risk of future events if you already have heart disease. Studies indicate that physically active people are less likely to develop coronary artery disease than those who are inactive, even after they account for other risk factors. One study of Harvard alumni over a 12-year period showed that those who exercised regularly had a 23% lower risk of death. So that's pretty significant. Another study showed that as little as 30 minutes of regular exercise daily reduced the risk of heart disease in women by 30 to 40%. Exercise has a beneficial effect on all of the risk factors for cardiovascular disease. Hypertension, for instance. If you start to exercise, you might see as much as a 4 to 9% drop in your millimeters of your systolic blood pressure, and even more than that with weight loss. And I can tell you clinically we see even more dramatic results than 9 millimeters of mercury after exercise. It has a very beneficial effect on your cholesterol because it helps boost your good cholesterol, the HDL. And if you remember, that's the cholesterol that goes through your bloodstream and sort of picks up the bad cholesterol. It's like a scavenger and brings it back to the liver for reprocessing so it doesn't collect in your arteries. And we know that if we don't have those plaques developing in our arteries and we have healthy arteries, translates into less risk of death and heart disease and heart attack. It's also a great stress reducer. We use exercise for a stress reduction strategy in many cases. And the best news is that the effects of exercise on decreasing risk factors overlap. So for instance, if you're decreasing your weight, it's also going to help your blood pressure. When you decrease your weight, it usually helps with blood sugar control. So you get many benefits from overlapping risk factor reduction. With regard to diabetes, being active and fit reduces your chance of developing type 2 diabetes. And research has shown that patients who are pre-diabetic, who exercise, decrease their risk of progression to frank diabetes by as much as 58%. So that's, pretty significant. So a lot of people have, risk factors for diabetes. They're overweight. They're carrying their weight in their middle. They have high triglycerides. They have what we call metabolic syndrome. And, they can start a plan and exercise and really help decrease their risk of developing frank diabetes. It also significantly lowers your risk of developing cardiovascular complications from diabetes if you already are a diabetic. And it's a great intervention for daily glycemic control. As most of you already know, exercise improves peripheral circulation. You heard that in several of the slides and presentations already today. Because atherosclerosis is a systemic disease, all your arteries are at risk. So what we do to prevent heart attacks, we're also doing to prevent the risk of stroke. So exercise is helping all of our arteries. In one study, exercise reduced the risk of stroke by 20% in moderately active people and 27% in highly active people. And the good news is that the benefits aren't limited to just the cardiovascular system. Individuals who exercise in addition to dieting for weight loss tend to maintain that weight loss in the long run. Regular exercise has also been shown to boost mood, mental wellness, relieve tension, anxiety. It's used in depression as a treatment, and it's been very effective, and it's used in anger management. Walking regularly even helps protect the aging brain against memory loss and dementia. If you're having trouble falling asleep, it's a good aid to help us fall asleep faster and sleep more soundly. It's been found to enhance your immune system. So I don't think that you can find a treatment, one treatment, that can do all of these things. I challenge the pharmaceutical industry to come up with one pill that can do as many things as I've mentioned so far. Regular activity helps delay or prevent chronic illnesses such as arthritis, osteoporosis, and digestive issues, things that are associated with aging. We can, stall them off for longer. And when we increase our muscle strength, we increase our ability to do other activities of daily living so that we can stay healthy and strong and independent longer. And that generally translates into better quality of life. The American Heart Association reports that for each hour of regular exercise, you'll gain 2 hours of additional life expectancy, even if you don't start until middle age. So it's all good news. There's if you do it safely, there's no bad news to exercise. So I'm going to turn the podium over to Lauren Healey, and she's going to talk to you about different types of exercise and give you some examples.
Hi. So many of you may already be involved in an exercise program, but if you're not, whether you are or not, there are some things to consider. There's many different components of fitness, and to being fit, it's not only just walking or only lifting weights. There's on this list, 5 different components that I would consider if you're thinking about embarking on an exercise program. The one that I'll get into the most detail today is aerobic fitness, which tends to have the most cardiovascular benefits and on your endurance, looking at 30 to 60 minutes most days of the week, and we'll get a little bit more into detail afterwards. Muscular fitness is also important, so that is basically your strength. So you improve your muscular fitness by lifting or pushing forces that are more than what you would typically do in a normal day. And that just, you can work your major muscle groups, and you really only need to do that 2 to 3 days per week. But there are some things that if you do them every day, of course, they're going to have some good benefit. Stretching is important to prevent injury, to maintain your range of motion at all your joints. And if you're going to be exercising frequently, your muscles tend to get tighter. So it's very important after you exercise to stretch back out. Core stability and balance training are 2 other things that we don't always necessarily think of, but are also very important. They sort of tie in together. So if you have good core stability, it improves your balance. But working your core and having a good strong core is important as well. And of course, as we get older, if we do get weaker, our balance tends to suffer too. So working on some balance exercise is also important. When we're talking about an aerobic exercise routine, you can think FIT, F-I-T, it's very fitting, for frequency, intensity, and duration when you're trying to figure out, is what I'm doing qualifying as a good aerobic exercise program? So for frequency, you want to aim for a minimum of 5 days per week. If you can do 6 or 7, that would be even better. There is no problem with exercising every day in the aerobic way. There's not going to be any detriment to doing that, except that if you start with too much too soon, you might be a little too fatigued or be at more risk for injury, and we'll talk about that a little bit. But you start with a smaller amount and build up. The American Heart Association recommends a minimum of 150 minutes per week. So if you think 30 minutes times 5 days, that's your 150 minutes. If you do longer, you get more health benefits. But we do focus on the 150 minutes per week. If you have diabetes, a new study has come out showing that you should spend no more than 2 consecutive days without exercise for better blood sugar control. So, whereas there's really nothing wrong with, say, exercising 3 days in a row and then going another 3 days without exercising, the more that you evenly space it, the better results you're going to have on blood sugar control. For intensity, we use what's called the Borg scale, and it's a very subjective scale that it doesn't really match up to any settings on any machines, or a speed on a treadmill or a setting on a bicycle. But you have it in your handouts, and it's a scale where you can measure your rating of perceived exertion, because it's really important that when you're doing aerobic exercise, it's not too easy, but that it's not too hard. When it's too hard, then we tend not to really want to do it. We don't enjoy it. We don't look forward to it. We tend to kind of shove it off the schedule. So exercise should feel moderate, which is on the scale, it's fairly light to somewhat hard. So when you're kind of in that zone, you feel like you could push more, but if you did, you'd probably be uncomfortable. You want to stay right below that threshold. I guess that makes sense. And again, that's best for endurance training, because most people can usually keep up a continuous movement exercise when they're at that level. And this is the Borg scale, and again, you have it on your handouts, and in that zone of 11 to 13 is recommended and is good for aerobic exercise. The other way that you can monitor intensity is by checking your heart rate or your pulse. A lot of treadmills and machines now have sensors that will give you your pulse for you when you're exercising, so that's one way to go. The other thing is, we can't really give a general what your heart rate should be for everybody in the room, because it's very individualized and it depends on your history and the condition of your cardiovascular system. So if you are not already exercising and you're thinking about, starting into, your own personal program, I would recommend that you contact your physician and see if there is, any specific heart rate or, any parameters or limits that they want to set for you. And sometimes, if you do have a history cardiovascular-wise, sometimes your physician wants to do a stress test before starting an exercise program, so that would be important to discuss, because sometimes what we do in our cardiac rehab program is we base an exercise prescription for a patient on how they did on their stress test. And generally we take 65 to 85% of the peak heart rate that they achieved on their stress test, and that's kind of like a nice zone for them to try to exercise in. And medications play a role too. Sometimes if you're on a medication such as a beta blocker, your heart rate doesn't get so high, and that's why it's important that we don't just look at the heart rate. Using the Borg scale, I think, can be quite good if you're not sure about using the heart rate and you haven't discussed anything with the physician yet. The time is important for building endurance and for really improving your cardiovascular system. You should aim for 30 to 60 minutes continuously, and there's that 150 minutes per week again. If you have not been exercising, or if it's new to you, starting at 30 minutes might be a lot. So what's recommended is that you start with whatever you can do to start, and then you gradually build up on that. If you can only walk 5 minutes, then maybe try to walk 5 minutes a few times a day so that you're adding it up. But over time, you'll find that as it starts to get easier, you'll be able to start adding more time and then build up to that 30. So don't feel like a failure if you don't do 30 all at once, because sometimes that's one reason that they come to me and they say, well, I can't exercise, I can't do the 30 minutes. Well, it's because they went out and tried to do 30 on day one and it didn't work so good, and then it really turned them off from exercising. So if you just start with a small amount first, that can be very helpful. And of course, the more minutes that you log per week, the more health benefits that you're going to have. When you are doing an exercise program, if you are able to do 30 or more minutes, it's important that you warm up, that you don't just start from standing still to going at a really, really fast pace. Warming up helps increase your heart rate at a gradual speed. It helps increase blood flow to your exercising muscles, because when you're resting, more of your blood flow is distributed towards your organs and things that your muscles aren't exercising, so it doesn't really need as much oxygen in blood flow. When you start to exercise, your body has to signal for that blood flow to be redistributed to where it's going to exercise, and that actually takes a little bit of time. So that's why you want to take a good 5 minutes at least to warm up. And it doesn't mean you have to, if you walk outdoors, you just start more slowly and you build up your speed. If you're on a treadmill, same thing. It also loosens up your muscles in your joints and decreases your risk of injury if you warm up and don't just jump right in. And if you do have any sort of cardiovascular history, or there is a risk of your heart not getting enough oxygen, which is called cardiac ischemia, ischemia just means a lack of oxygen, then warming up can help reduce the likelihood of that and reduce the likelihood of an arrhythmia developing. The cool down is the reverse of a warm-up. So when you're thinking that you're going to be stopping your exercise session for the day, you want to take at least your last 5 minutes and gradually slow yourself down. Again, the body doesn't like sudden stops and starts. You want to let your signal to your body that you're going to be stopping soon, so decrease your speed, decrease your heart rate. Helps clear lactic acid out of your muscles, which is a byproduct of the metabolism, and when it sits in your muscles it can be uncomfortable, so that's good to help keep things circulating out. Cooling down also decreases your risk of lack of oxygen to your heart, or that ischemia that I mentioned, also decreases your risk of having an arrhythmia, and it also reduces your risk of a potential sudden drop in blood pressure if you just suddenly stop. And if your blood pressure drops, you can feel dizzy, you can feel lightheaded, uncomfortable, unsteady, so that's not a beneficial thing for you either. And also a cool down literally does cool your body down. When you exercise, your core temperature rises. It doesn't like to remain high, so you want to decrease your core temperature too while you're cooling down. Stretching is important for maintaining a full range of motion at your joints over time. If we become more sedentary, we tend not to push our limbs through their full range of motion. So, stretching ensures that you're doing that on a daily basis and you're maintaining that. Having range of motion is also helpful for maintaining good balance, especially at the ankles, the knees, the hips. As people get stiffer, sometimes they tend to have less ability to move and catch themselves when they do get thrown off their center of support. So having good flexibility helps maintain that. And then also stretching also reduces your risk of back pain, falls, other types of injuries as well. So on the handouts that have been given out, there are some basic stretches on there as well with some instructions if you are interested in just some of your major ones. Yes? We certainly do. Yep. There are also benefits to strength training, which is another key component of fitness. Strength training increases your strength, it increases your muscle endurance. It can also increase your walking speed and your bone mineral density. So that can be very important if you know you have a history of osteopenia or are at risk for osteoporosis. When you strengthen your muscles, you also strengthen the bone that's underneath those muscles. So having more strength is going to keep your skeleton stronger as a whole. It can decrease your risk of falling because you're going to be more capable of, rewriting yourself if you have a sudden loss of balance. And if one of your goals is weight loss, then strength training can also help increase your metabolism or your metabolic rate. So what that means is if you have more muscle mass in your system, you're going to be burning calories not only when you exercise, but that muscle mass is going to continue to burn calories at a faster rate even when you're resting. So you're going to be, more efficient at that and have a better chance of weight loss. And then also, being stronger just decreases the demand on your heart when you're doing certain activities, and it also, I think, in many people improves self-confidence and independence because you're relying less so on others for doing certain tasks that require more strength. So these are all in your handouts. These are just some basic exercises that can be done, whether it's, at home, in your office, at, anytime. Some of them only require a chair. This is a basic sit-to-stand exercise, which works the lower extremities. If you can get your hands on a TheraBand or an elastic type band, which you might be able to buy at a Walmart or a sports store, this is just a very simple, you place it around your back and you can, box forward, and that strengthens your shoulders and your triceps and your upper extremities. That can be very good, and the TheraBands can be used in virtually any direction, so you can do all sorts of different type of exercises with bands. A triceps push. Again, a chair with arms would be helpful to have for this, but again, using your legs as little as possible. You're lifting yourself up out of your chair, hold yourself up there for about 5 seconds, and do that repetitively, and you can do that throughout the day to work your arm muscles. And just an aside, make sure when you're doing all of these exercises that you remember to breathe. You don't want to hold your breath when you're doing any of these because that can cause some problems with your circulation and your blood pressure. So make sure that you're breathing nice and steady and nice and evenly with this type of stuff. A biceps curl, again, if you don't have a free weight, this can be done with maybe using a soup can in your kitchen to start. And of course, if you progress and you need something heavier, then you might want to go out and purchase some light weights or something like that. And then the step up also works on your balance. If you have some stairs at your house, not maybe on the top step, but on the bottom step where you're closer to the floor, doing some step-ups, maybe 10 with one side, 10 with the other. For more challenge to your balance, try not to use your hands. And step up, step down repetitively, and that works your lower extremity muscles too. And then the single leg stance pulls in a lot of muscles in your lower extremity. It works around your ankle, your knee, your hip. You have to pull in your core muscles to maintain your balance. Just make sure you're standing near something to catch, something sturdy if you lose your balance, and use a timer and time yourself and see over time how that increases. And with that, I'm going to return back to Gisele, and she's going to finish up, and then we'll open up to questions. Okay?
Thank you. Sure. So a lot of people ask us, what's the best time of day to exercise? And the answer to that is when you're going to consistently show up. It doesn't really matter what time of day you exercise as long as it's a time that works for you. The only real time we recommend that you don't exercise is right after a meal. We think that you should exercise before you eat or wait at least an hour after you eat before you exercise, similar to the old recommendations they used to give us as kids about swimming. So don't exercise if you're sick, if you have a bad cold, you have a fever, you have the flu, because your body's already working hard at that point and you don't need to add the added stress of exercise. But other than that, any time of day is fine to exercise. And we also hear from patients a lot that, well, I can't fit in 30 minutes or I can't fit in 60 minutes. It just seems like an awful lot of time. I don't know when to fit it into my day. So if that's a problem, then squeeze in a few 10-minute walks throughout the day. Get up from your desk at a break and, walk around your building or go outside if you can and get some fresh air too and take a little bit of a walk. You're still going to get benefits to risk factors with shorter bursts of exercise, so avoid that all or nothing thinking. And remember that other activities count too. So if you're doing exercises like housekeeping or gardening or you walk your dog, that all counts towards your total activity. And you don't really have to exercise strenuously. The old adage of no pain, no gain is false. As Lauren, explained, you want to be in that 11 to 13 range of somewhat hard, but you don't have to be, really pouring sweat and, breathing heavy to get a benefit from exercise. And you'll find that as you start an exercise program, you will want to gradually increase your frequency and duration, and then your benefits will improve. So schedule it into your day. Oftentimes we put everything else in our BlackBerry and our iPod and our calendar, but we don't put down what we need to do for ourselves. So you don't schedule your lunch, you don't schedule a break, you don't schedule exercise. But we found that patients who do tend to keep that schedule because it's already planned into their day. Oftentimes we see patients who come in and they say, well, I was going to exercise 4 times this week, but it's already Thursday and I haven't gotten to it. What should I do now? So if you actually have it planned into your week, you're going to see as you go whether or not you came up to your expectations and your goals for that week. So start off slowly, pace yourself, be realistic. We are recommending 5 or greater days of the week, and as our nutritionist at work always tells us, you should exercise every day you eat. So it's a nice way to frame it up if you're trying to remember, gee, should I really exercise today? Well, I ate, so it's probably a good idea. So keep a log. In the back of one of the handouts that we gave you, there's a nice log to help you track your exercise. Some people find that they just can't get it into their day because they're so busy, so they get up earlier and do it first thing before they go out for the rest of the day, and that's okay if that works for you. If not, as we mentioned, maybe at lunch or right after work, an hour after supper. And then you can do other things to sort of just increase activity, like taking the stairs instead of the elevator, parking farther away from the entrance instead of trying to fight for that parking space right in front of the door of the mall. A lot of people have started mall walking, and there's a lot of clubs now that you can join. The malls open usually before the stores open, so you can walk around the malls in the morning, and I think, well, I'm not sure about the evening hours, but I'm sure about the morning hours that they open up and they let you walk around in the mall before the stores open. You can do that by yourself or with a group. You might think about joining a health club. There's a lot of health clubs now that are offering really, much more reasonable rates than they used to. Try a new class. If you don't like to just go in and, exercise on a treadmill, maybe one of the group classes is something that will catch you, like a Zumba class or a Pilates class. oftentimes people find that if they have a buddy to exercise with, they stick with the program more consistently, because you're much more likely to keep an appointment with a person than you are with the treadmill. So if you have a buddy that you can, connect with, so that you call them, they call you on the day that you're not feeling quite like exercising, they'll motivate you, and vice versa. Video equipment, home equipment is out now. You have Wii systems and PlayStation systems that all have great exercise videos and games on there to make it fun and interesting. And the real thing is, you have to make it fun for you. You have to make it what you like to do. So pick something that you like, and the chances are you're going to stick with it. So I'd like to thank you and open it up for any questions. We have a few more minutes if anyone has any questions for Lauren or myself.
That would be, on an individual basis. If there's someone they could refer you to, like a physical therapist, to maybe get you working. Yes, if you start with something, if it's more than what you're doing now, you're definitely going to benefit.
And 2 or 3 times a week, every other.
Absolutely, absolutely. And as you become, one rule of thumb I use is that if you can't get to 10 repetitions in a row, then the weight is too heavy. If you can easily do 20 or 25, then the weight might be getting a bit light for you, and it might be time to move up. So somewhere between doing 10 and 20 repetitions, if you can do that fairly easily over time, that should be helpful. And then as you start being able to do more, then you can kind of gradually move that weight up little by little, like a pound at a time. But that would be something that, from 2007 to now, it's been 5 years. If there's no other restrictions or contraindications, I think that it would probably be okay to go back to doing it.
Thank you.
Yep, you're welcome.